Yes. Now, hospital admissions linked to obesity have doubled in 6 years to more than 3,000 people a day being admitted into hospital. It really does highlight the extent of Britain's weight problem.
Well, we're going to see what can be done about this. Former presenter of Fat Families is Steve Miller, no stranger to this programme. And we're also going to talk to the chairman of the National Obesity Forum, Tam Fry. Let's go to you first, Steve. What do you make of this? You're a bit of a fattist, aren't you?
Well, I'm not a fattist. I mean, people accuse me often of fat shaming. I actually think I'm a lifesaver, not a fat shamer. But what we've done in this country, of course, is developed. We've developed chubster culture, where it's kind of cool now to be a jelly-bellied jumbo. To be quite honest with you, we, on the one hand, say to everybody it's really important to manage your health and manage your weight. And then on the other hand, we have this culture that celebrates fat, that actually says no, 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 it's wonderful. We even have fat pride, where people get together and they love their curves, which actually means love your fat. This is our biggest problem. What we love to do, of course, in the UK is come up with lots of excuses. We like to blame the government. We like to blame the food manufacturers, when in fact what we should be doing is pointing the finger at ourselves.
Tam Fry, are we celebrating our fatness?
No, I hope not. I think that Mr. Miller is absolutely wrong. We have got a government that has, or successive governments since the year 2000, that have done absolutely nothing for obesity. And therefore we have the problem we have because of the government's own indolence. It was told in 2007 that to blame people themselves of having no responsibility on what they eat is totally wrong. They've got to eat, and the food which is available is less than healthy. I welcome very much Victoria Atkins' resolve to introduce healthy living, but she's going to have a real problem because she's married to a sugar tycoon, and sugar is the greatest ill for obesity. And I find it very difficult to understand how the government is going to take on obesity when the health minister herself recuses herself from the argument.
But, Tam, a bit of nanny state coming in from you here. Shouldn't people take some responsibility themselves for what they eat? They don't have to eat processed food. They could buy some vegetables, which are quite cheap. And if they don't know how to cook them, look it up on the internet, because you don't even have to buy a cookery book anymore.
I think that's a very simplistic view of life. We have millions of families who don't know how to cook because they were never taught to cook in schools. And it is also true to say that buying vegetables is more expensive. And in this cost of living crisis, the people will go for the cheapest option because they've got to feed themselves somehow.
Steve, what do you make of that then? Is it a simplistic view of life to go to the shop and buy vegetables instead of a burger?
Well, I mean, Tam's been blaming the government for quite a few years. I think that's garbage. I think the reality is, when you look deep into it, actually eating healthier can be cheaper. I think the way the government could help actually is to partner with the supermarkets and to proactively promote, cheaper foods, especially in poorer areas. And I get that, and I would support that. But what we're missing here is the responsibility factor. In Japan, for example, they are big on the responsibility factor. Their obesity rate is around 6%. Ours is over 20%. And the reason for that is we've got into this sort of fat pride mentality where it's cool to be fat. And, if you ever talk about how wrong it is to be fat, you're called a fat shamer. Well, I don't agree with that. I think we have to be much more direct and we have to be much more straight talking. And this country, because of its new kind of trendy woke culture, is all too namby-pamby. We're frightened to talk about it and be a bit more direct. Yes, support people, but people need to support themselves as well.
Tam, is it one of the answers in your book, tax unhealthy food? Of course, it's going to be the cheaper food which the poorer families are buying, but is that one of the solutions you would advocate?
Well, one of this particular solution is not to tax the food, but to levy the industry that produces the food. The sugary drinks industry levy in 2018 worked terrifically because the government decided that it was the industry which was the villain. They said, if you take sugar out of your fizzy drinks, we will not levy you, but if you don't, we will levy you greatly. And what the sugar industry did was to get around at boardroom tables and say how stupid that we should pay the government lots of money, we'll take sugar out of our drinks. And they've taken an enormous amount of sugar, and that is already having beneficial effects. I'd like to just reply to Mr. Miller, if I may. He's raised the issue of Japan, and he's absolutely pro-Japan. No problem with their obesity, but what they did in 2008 was to introduce a law. And the law said you will measure your waist every year. And if it doesn't fall within prescribed boundaries, your employer will be fined. What happened? Employers started to have exercise classes in their homes, in their workplaces, and the Japanese measured each other, and they have now 6% as opposed to our 20-odd%. And that is the way to go about it. You need to have intervention from government in order to make people do what is required.
OK, that is the chairman of the National Obesity Forum, Tam Fry, and also the former presenter of Fat Families, Steve Miller. Thank you very much for debating that with us this morning. Thank you very much indeed.